Hello, and welcome to an overview of medical imaging. Medical imaging is defined as a discipline within healthcare, where a variety of complex technologies and computer applications are used to create visual representations of the interior of the body for clinical analysis and medical intervention. As a diagnostic tool, it relies on the use of invisible waves, such as electromagnetic radiation, magnetic fields, or sound waves. Although there are many forms of medical imaging out there, 4 of the most commonly used in patient care today include X-ray, computed tomography or CT scan, sonography, more commonly known as ultrasound, and magnetic resonance imaging, or MRI. Of the 4 most common forms of medical imaging, it's likely that you've personally had an X-ray in the past, since it's often used in both medical and dental practices. Most medical students will be working closely with patients in their future careers, so it's important to know which physician specialties regularly use medical imaging. The simple answer is, they all do. The list you see in this slide contains just a few of the many physician specialties that regularly use medical imaging as part of their patient care process. Opportunities to learn more about medical imaging will run through all 4 years of your medical education. From the preclinical years in the classroom, where a full radiology thread exists within the gross anatomy thread, to the 3rd year, where you'll work with residents and attendings to learn more about how medical images are interpreted and how they're used as a diagnostic tool to help identify and monitor illness and disease. And finally, to your 4th year, when you start to specialize, by taking specific courses and acting internships, that will help you prepare for the intern year of your desired residency. Ultimately, you may find that your learning experiences guide your interests to thoughts of specializing in medical imaging in the field of radiology itself. As many specialties, becoming a radiologist requires a 4-year residency and a 1 to 2-year fellowship in a particular radiological subspecialty, such as interventional radiology. The importance of medical imaging cannot be understated. Whether you're in orthopedics or pediatrics, it's truly an invaluable element of healthcare today. It provides physicians with information for the diagnosis and treatment of common injuries, such as a broken bone, an illness such as a sinus infection, or a disease such as cancer. In addition, medical imaging can help physicians with patient care in areas other than injuries, illness, or disease, as an ultrasound or sonogram is a common method used to monitor and track the progress of a growing fetus. Susan Kelly, of Bard Medical Staffing, explains that since November of 1895, when X-rays were first discovered, medical imaging has advanced immensely to where we are today. And since the 1970s, the industry has experienced massive innovation with the invention of CT and MRI scanners, and position emission tomography, or the PET scanner. As many things in our world, medical imaging is in a constant state of evolution, and the future of medical imaging technology has many exciting prospects. It's very possible that you'll have the opportunity to be part of the next wave of medical imaging innovation, where the large MRI and CT machines of today are replaced with handheld scanners. If you're interested in learning more about the future of medical imaging, please visit one of the sites listed in this slide. Thank you for watching. We'd like to know your thoughts on medical imaging, so please take a moment to answer the 2 corresponding assessment questions.